Hey, Tiana here from Mind Body Movement Center. This is a practice to address any front hip or anterior hip tightness or discomfort. Sometimes you might feel a burning sensation in there, or it just feels really tight, especially if you sit a lot or you cross your legs when you're sitting. Could be driving, computer work. So I'm going to show a pre-test. We're going to do a few things and then a post-test, and we'll see how it feels. So first, what you need for this are one strap. This is, I think this is actually a 10-foot strap, but I think 8-foot, depending on how long your legs are. And it should have a buckle of some sort. So either a cinch buckle or a clip buckle. I like the clip buckle just because it's easiest to deal with and doesn't get all tied up. If you have really long legs, you might need two straps, because you're just not going to have enough space. So we'll set those off to the side for the moment. You're going to come onto your back. And first, to check, so I'm going to deal with my left hip because it's more of an issue, so we'll just address it with that. Keeping your knees bent, take your left, or whatever hip you're working with, that knee towards your chest. And just notice where you're feeling the sensation. So if you feel like it's more, like you're not really getting a stretch back through here, but you're feeling more of a stretch, or not a stretch, but like a locking, like just doesn't feel like it wants to move, like it's stuck or feels uncomfortable, more in the groin, in the front of the hip, in that hip crease. So you're just going to test that and see what that feels like. And then we'll do this crossover where you take the left foot to the right knee, and you can stop there and just see how that feels, and then try drawing that knee, the right knee, towards your chest and clasping either behind it. I usually like to grab onto the knee and the foot of that same side so I can just maneuver it around a little bit. So you're just going to feel what that feels like in that position. And the ability, the range of motion, does it feel more like front hip that's blocking it, or do you actually get a stretch back here? And of course you could do side to side because you want to see what it could feel like in your unaffected leg, so to speak. So for instance, on this side, I feel nothing on the front of the hip. And then crossing over, this hip has more range of motion. You can feel that. So you can do side to side and see what, so to speak, your normal is. All right, so now to get this ready, we've got this strap, and you're gonna wanna buckle the strap into a big buckle, big wide circle loop. Now the end of the loop is gonna go around your opposite foot. So it's around the ball of my right foot. And then the big part of the loop is coming into my hip crease, or the groin. Now I have the buckle close by me so that I can adjust it. If it's way down there, you're not going to be able to adjust it. So you want it up where you can cinch it tighter or let it loose. All right, so I've got this around the mound or the ball of the right foot into the hip crease of my left with the loop. And I want it deep in there, as deep as I can get it. And if it's uncomfortable, you can always put a washcloth or a towel between you and the strap. And you want it such, I've actually got it quite in a good fit right here. You want it so that you can bring this knee towards you. At the same time, I'm pressing away with the ball of my right foot. So I've got some traction there, going that way with that foot and this way with my hip or my knee. And actually the traction is happening right here at the groin, or the femur, the head of the femur, as it's heading down towards my opposite foot. And then relax the shoulders and breathe. And so you can do little pulses, or actually I'm gonna just hold. So I've got it in a good spot where I can just hold it and breathe. Relax the jaw, the eyes, the shoulders. And I can bring this knee out a little bit to kind of get different angle of pull. So I'm bringing the knee out to the left a little bit to get a little bit different angle as I'm continuing to push through that right foot. I don't want to take it too far across middle, but I could try a little bit. So I've just got it maybe right in the midline, my knee. All right, maybe another breath here. You can certainly stay longer depending on how much you need. All right, and then I'm going to let go of that. So that's why if you're taller, you're going to need two straps buckled together so you have enough length if you have really long legs. So now I'm going to do an offset bridge. So we did a little downward glide of that left femoral head to get it out of that space of that pushing anteriorly or forward that's causing perhaps that discomfort that's happening there. And now I'm going to do an offset bridge. So my right foot, I'm addressing my left leg, so my right foot's going to be a little bit more forward than my left, about the length of my foot. And then I'm going to rise up into a bridge. So what this will do, will put more weight into your affected leg, or the one that you're working with. And I'm just going to hold it there. And I might do just some pulses where I go up and down, so maybe 5. And I'm trying to let go of my right glute or butt cheek. So I'm just trying to activate those posterior muscles, so we got the reduction of the stress on the front of the hip. So I'm trying to activate the back side so as to maintain that good position of the hip and the femur. And I can already start feeling, when I first started these, I could feel some discomfort in the front of the hip. And now I can already start to feel that reducing here now that it's not as uncomfortable. Relax the jaw, the eyes, the shoulders, and I'll probably just count to 10. While I'm breathing. All right, I'm going to lower down, and then we're going to retest those same positions that we did before. So I want that leg in the same position that I had it. And now as I come into here, I have much more space. I will say I still have a little bit of sensation there, but it's not like it was before. I have way more space, and I'm feeling more back here than I am in the front. All right, and then I'll cross over and retest that. So you just want to retest the same that you did in the first. So if you grabbed here, grab here. If you grabbed here, grab there. And now I can just feel like I have more play, a little bit more space. And instead of feeling that groin discomfort, I'm feeling more stretch on the outer hip, which is where ideally you might be feeling it, or maybe into the inner thigh. All right, so that's it. Leave any comments below if you have questions, or it worked for you, or it's helpful or wasn't helpful. I'd love to hear. Also check out mindbodymovement.org if you need any further instruction specifically for yourself for either physical therapy or yoga therapy. All right, take care. Peace in.